Hi guys, happy Friday. Welcome back to the Q&A. Today I'm going to be answering your questions about a highly requested topic, and that is hidradenitis suppurativa. If you are not familiar with hidradenitis suppurativa, it is a fairly common inflammatory skin condition characterized by inflammation around the hair follicles, under the armpits, under the breasts in women, in the abdominal fold areas, in the groin, as well as in the perianal area. It consists of inflammatory, painful red nodules, bumps, cysts, quote, boils that subsequently rupture and become even more inflamed and then fuse with one another to develop sinus tracts and fistulas that can drain inflammatory fluid out to the surface of the skin and ultimately, unfortunately, result in scarring. The impact this disease has on somebody's quality of life is profound. Not only is it painful, but coping with these weeping inflammatory nodules in these sensitive areas is such a difficult burden on behalf of the patient with hidradenitis suppurativa. It is an incredibly difficult disease to live with and to cope with. It has tremendous effects on the individual's overall psychological health as well. It's very depressing, frankly, to cope with this disease and can be incredibly anxiety-provoking, something I will touch on later in the video. Its prevalence is estimated at about anywhere from 1 to 4% of the population, which is pretty common actually for diseases in dermatology. We tend to see the rarer things in medicine and dermatology. So 1 to 4% is pretty high for us. And it tends to be it's also more prevalent in women. It occurs in women about 3 times more often than men. Onset of disease is typically around your 20s. However, if you have a family history of hidradenitis suppurativa, onset can be even earlier, sometime usually around puberty or close to the start of puberty. And it's estimated, unfortunately, that an individual with hidradenitis suppurativa will go, on average, about 7 years coping with this disease before they actually get an accurate, correct diagnosis. Either because they are attempting to self-treat and manage it on their own before seeking the attention of their healthcare provider, or they are misdiagnosed. Hidradenitis suppurativa can look an awful lot like many other similar skin conditions: infectious boils, cellulitis, abscesses. And so it is not uncommon for them to be treated as an infection a few times before an accurate diagnosis is actually made. But if you have this disease, I really want you to understand that at its heart, at its root, in terms of what causes it and what you need to know about the nature of this disease, is that it actually is a systemic disease that happens to have these dreadful skin manifestations. Meaning that the skin manifestations of this disease reflect something going on a bigger level inside your body. And that is, namely, inflammation in the body and a dysregulation of your immune system. A key driver in the pathophysiology of hidradenitis suppurativa is thought to be related to immune dysregulation focusing around the hair follicles. And this results in upregulation of key inflammatory signals that drive proliferation of cells in that hair follicle in those areas of skin that I mentioned, the folds, the armpits, the groin. Results in proliferation of those skin cells that then plug up the follicle, the pore, the hair follicle, and occlude it. And then that occluded hair follicle then fills up with cellular debris and sebum, and then subsequently ruptures, recruiting more inflammation into the area. Upon rupture, the surrounding tissue is damaged, and that can result in scars and what are referred to as fistula tracts. So draining almost tubes of scarred down tissue that release inflammatory fluid onto the surface of the skin. This immune dysregulation around the hair follicle is something that we see in a few other skin diseases in dermatology that many patients with hidradenitis suppurativa also suffer from. These are diseases known as diseases of follicular occlusion. They include not only hidradenitis suppurativa, but severe acne known as acne conglobata, as well as something called pilonidal cysts, pilonidal sinuses that can occur right above the gluteal cleft, right above your butt crack, basically. As well as something on the scalp that can occur more often in men, which is called dissecting cellulitis. Think of it as kind of the same skin lesions, only on the scalp. Painful bumps around the hair follicle that fuse to form draining sinuses and ultimately result in scars. Very painful, likewise very difficult to cope with. So many people who have hidradenitis suppurativa also have these other diseases of follicular occlusion. And if you have all of them, you're often labeled as having the follicular occlusion tetrad. So that would be hidradenitis suppurativa, acne conglobata, dissecting cellulitis, and pilonidal cyst. They all have at their heart this immune dysregulation that focuses around the hair follicle. It was once thought that perhaps hidradenitis suppurativa was an infectious process. We now have a better understanding, though, that this is in fact an abnormal inflammatory response around the hair follicles. When we take swabs, bacterial swabs and cultures of either the fluid that comes out of the skin lesions of hidradenitis or the surface of the skin, for the most part, those skin cultures often grow out normal bacteria flora. So the initiating events of hidradenitis suppurativa are not an infectious process whatsoever. However, as the disease progresses and the skin barrier becomes inflamed, impaired, those sinus tracts and fistulas develop, they are a setup and a surface that is conducive to the formation of what's called a biofilm, and that is a film of bacteria and bacterial kind of constituents that is really, really hardy and adherent to that surface and presents another signal for your immune system, which is already coming to that area of the skin abnormally, to get even more ramped up. So in other words, while at its heart, hidradenitis suppurativa is an inflammatory skin disease resulting from your immune system abnormally coming to the skin in these areas, secondary formation of biofilms can further contribute to disease progression and exacerbations of flares of this disease. Like everything in dermatology and in medicine, you can thank your parents to a certain extent for this disease. We believe that there is a genetic predisposition to having hidradenitis suppurativa. Approximately 1/3 of individuals with hidradenitis suppurativa will have a family member who also has this disease, or will have one of its comorbid or co-associated diseases, which I'll mention in a little while. An unusually strong association with hidradenitis suppurativa is smoking, tobacco smoke. About 70% of people who have hidradenitis suppurativa also smoke tobacco. And this is probably the worst thing that you can do for hidradenitis suppurativa. Whether or not having an abnormal level of inflammation in your body drives you to smoke, that I can't say. But individuals who have this disease, they have some of the most severe disease if they smoke. Because when you smoke tobacco, when you smoke cigarettes, you are elevating all the inflammation in your body. And if you have an inflammatory disease, guess what's going to get revved up? That disease. So people who smoke have the worst disease. So in dermatology clinics, we see the worst, people with more severe manifestations. So about 70% of those individuals that we see in dermatology with hidradenitis suppurativa also smoke. And the smoking is a lifestyle factor that must be addressed because otherwise no treatment is really going to work optimally, and this disease will continue to progress. As the disease progresses, the scarring, the pain, it can become incredibly, incredibly debilitating. In addition to smoking, another lifestyle factor that is strongly associated and correlated with disease severity is obesity. Having inflammatory disease makes you at greater risk for having difficulty with weight management and being at risk for obesity. And obesity then further contributes to more inflammation in your body. Fat can release inflammatory compounds that then drive this disease. There is a strong association between increasing BMI and increasing disease severity of hidradenitis suppurativa. So if you have this disease, there is a very good chance that your dermatologist is going to address some aspect of your weight and weight management in the control of this disease. No one likes being told that they have to lose weight, and if you have battled with your weight your entire life, it's really annoying to hear that. And when you go to the dermatologist, it can almost be 10 times more annoying because you're like, I'm here for my skin. Why do I have to hear about my weight? Because the disease is a disease of abnormal inflammation that puts you at risk for obesity, and the obesity then loops back into the disease severity of the hidradenitis suppurativa. So that's why we have to address it. And I know it's not a fun topic, but it's not just something that's being singled out to make you feel bad about yourself or to harp on something that you probably have heard many times in your life and are sick of hearing. Before I overview some of the basic treatments and principles of treatment, the other aspect of this disease that I really want to emphasize to you guys is that it is, at its heart, a systemic disease with skin manifestations. So the abnormal inflammation coming into those areas around the hair follicle, that reflects an abnormality internally with the immune system and high levels of inflammation in the body. And because of that, there is a strong comorbid association of having this disease with having a few other diseases, which I'll explain. The first comorbid association, many people with hidradenitis suppurativa also have inflammatory bowel disease. Inflammatory bowel diseases are types of diseases of the immune system where you have abnormal inflammation coming into the gut. These include Crohn's disease and ulcerative colitis. About 26% of people with Crohn's disease also have hidradenitis suppurativa. And people with Crohn's disease also, at periods of time in their disease, can get skin lesions that look similar to hidradenitis suppurativa. So they are tightly associated and tightly linked. And having a family history of inflammatory bowel disease also can be a risk factor for having hidradenitis suppurativa. So that speaks to the underlying genetic problem and hopefully emphasizes to you that this is more than a skin disease. It is a skin disease that can affect, it is a systemic disease that not only has skin manifestations, but also can have manifestations in other areas of your body. In addition to the association with inflammatory bowel disease, there also is a strong association of this disease with cardiovascular disease, specifically atherosclerosis and cardiovascular problems, heart disease. And that makes a lot of sense if you think about this as a systemic disease with high levels of inflammation. Inflammation in the body drives cardiovascular disease. It affects the lining of our blood vessels and it affects the function of our cardiovascular system. There's a strong association. And I'm telling you this also because if you have this disease, you have to make sure that you are following up with your primary care provider and having age-appropriate screening for these comorbid cardiovascular complications to make sure they're not developing. Particularly in situations where the disease is really amped up, think of it as you're on high alert for inflammation in the body and greater risk for cardiovascular disease. The third comorbid disease, though, that is not often thought about, you think about having a skin disease, is psychiatric illness, specifically depression. There is a tight association between hidradenitis suppurativa and comorbid depression. You can, think about it as the fact that hidradenitis suppurativa, having to cope with these painful, unsightly skin lesions is depressing. But also, if you think about it as what it is, a systemic inflammatory disease, when there are high levels of inflammation in the body, that can feed the fuel for illnesses such as depression. It can affect your sleep cycle, the quality of sleep, and set you up for comorbid depression. And so that is a very, very critical aspect of managing your hidradenitis suppurativa, is to definitely check in with your overall mental health. And while depression is the most strongly associated comorbid psychiatric illness with hidradenitis suppurativa. There also is an association with anxiety and bipolar disease. So mental health is a major aspect of having this disease that needs to be addressed. So bearing that in mind, how do we go about approaching it? In dermatology, we will take a look at the burden of disease, how many lesions you have, how the degree of severity, and kind of build a treatment algorithm based on that. Topical treatments for this disease are never going to cure it necessarily, but they can help control some of the skin manifestations. I mentioned earlier that a risk and something that can develop are biofilms forming on the lesions of hidradenitis suppurativa that can further exacerbate skin manifestations. A key management of hidradenitis suppurativa is topical antiseptics. Antiseptics that are used on the skin of these affected areas include things like topical benzoyl peroxide, chlorhexidine body washes, liquids, and also betadine surgical scrub is another antiseptic that can be applied to the skin, left on the skin for a few minutes of the affected areas, and then rinsed off. So those are some generic antiseptics that are helpful for hygiene of the area, and they have to be continued on an ongoing basis. Those are antiseptics that you can find in the drugstore and that your healthcare provider can guide you on as far as how to use and the frequency of use. In addition to those over-the-counter things that help to reduce the burden of bacterial colonization on the surface of the skin, a prescription antibiotic that can be applied to the skin is one called clindamycin. Moving up along the ladder then, going to a systemic medication, the next type of treatment would be a systemic antibiotic, meaning an antibiotic pill that you take by mouth. We use antibiotics a lot in dermatology, and we try and have the best stewardship with dispensing antibiotics and use, and we try and limit their use. But they are very helpful for many inflammatory diseases in dermatology because they lower inflammation and they lower it in the skin pretty well. It can help get control of disease. An oral antibiotic that is frequently prescribed for this disease is a tetracycline at a dose of around 500 milligrams twice a day. Typically, this is continued for about 3 months with the ideal of getting control of the disease and then tapering off of the antibiotic, because long-term use of an oral antibiotic like tetracycline comes with the risk of bacterial resistance as well as GI upset, and so the goal is never to keep you on that indefinitely. If the oral tetracycline course is not helpful, a next step or a next in line consideration is a combination of antibiotics taken for a similar period of time. Specifically, a combination of antibiotics are rifampin 300 milligrams twice a day along with clindamycin 300 milligrams twice a day. This combination of drugs is sort of next in line as far as antibiotics that largely help to reduce the inflammation in the skin and help get control of the disease. But again, with antibiotics, the goal is never to keep you on them long term because of the risk of bacterial resistance. And when you are prescribed these oral antibiotics, the topical antiseptics like the Hibiclens are continued to help reduce further the risk of you developing bacterial resistance, at least within the skin. After topicals and oral antibiotics have failed, the kind of next in line approach is to use systemic medications that lower inflammation in the body and can help kind of address the occlusion process that's going on in the hair follicle. Systemic retinoids like one called acitretin or soriatane, as well as isotretinoin or Accutane, often will be trialed, attempted. To be honest with you, Accutane modestly to minimally helpful. Some people do respond well to a course of an oral retinoid, so it's frequently pursued. And, you know, I have a video talking about Accutane, so check that out if you are at all curious. But Accutane is contraindicated in women who are attempting to get pregnant. So, you know, depending on where you are in your life, it may not be the best choice for you. In addition to systemic retinoids, there are also a variety of other medications used in dermatology. One is called cyclosporin. This can help calm down the inflammation quite a bit and get good control of the disease. Unfortunately, when that medication is stopped, the disease does often come right back. And that medication, while safe, is associated with, there are side effects that need to be monitored. It can affect your kidneys, and it can put you at risk for high blood pressure and a variety of lab abnormalities. So it requires a lot of monitoring. But now that we have a better understanding that this is a disease where there is immune dysregulation coming into the skin, we now have a battery of drugs, agents called biologics that target certain arms of the immune system, certain soldiers, if you will, in the war on your hair follicle. These drugs help to knock down, knock out. One such class of biologic drugs are those known as anti-TNF-alpha inhibitors. These include adalimumab, brand name Humira, or etanercept, brand name Enbrel. These are both used to treat and control hidradenitis suppurativa. Another medication that wipes out and controls another arm of the immune dysregulation cascade is a medication called anakinra. This is another medication that is frequently used and has some good data in hidradenitis suppurativa, has some good data in hidradenitis suppurativa in people with inflammatory bowel disease as well. So, those are some of the bigger gun, if you will, systemic medications that people with really severe disease, their doctors are going to start considering. With the aim of not only getting control of the skin disease, but addressing the total body burden of inflammatory disease. Sometimes these bigger gun systemic medications that lower the inflammation in the body, not only do they help with skin disease, but they help begin to control and address some of the other facets of the disease as a systemic process, like the cardiovascular disease. But those are systemic medications, meaning things that you put into your body to control this disease. One other aspect of treating and managing the disease that is really important is some kind of surgical management, meaning procedures that tackle the skin lesions. That almost is imperative because some of the resulting skin disease is just not going to be touched by those medications. You've got these big sinus tracts, draining lesions, nodules, scarred down fibrosed tissue. Penetration of drugs into those areas, penetration of these anti-inflammatory medications into those areas is not going to be effective, and it's not going to clear the existing scarred down tissue. And that scarred down tissue is sort of a nidus for biofilm formation. Surgical management is really important, and that includes something called incision and drainage. So going in, numbing the area and making an incision into the nodules and draining them of that inflammatory fluid to decompress them and allow the medicine to get into the lesion much better. Additionally, the injection of a steroid into the painful nodules can help shrink them down and get rid of the pain. And then a very important part of treating this disease is excision of the existing disease. Existing disease meaning the sinus tracts and the fistulas, going in and having a surgeon actually cut that out. It's a rather involved surgery, and there's quite a bit of healing time associated with it. So it is definitely not an easy disease to cope with at all. And if you have a severe case of hidradenitis suppurativa, it can make your life a living nightmare. It's no wonder depression is a comorbid illness. It is such a nightmare to live with this disease. I would not wish this disease on my worst enemy. It is so painful and so debilitating, and when these lesions drain, you have to cope with that fluid drainage, and it can smell foul, it can make the person feel embarrassed, and it's just very, very difficult. One of the other surgical aspects of managing this that I forgot to mention is laser. CO2 laser and Indy-YAG laser specifically for resurfacing and targeting the lesions is also an effective additional treatment to go alongside addressing the actual existing burden of disease. So surgery is a really big part of managing this and getting it under control. Medications also for calming down the inflammation and addressing the issue of having high inflammation. But then on the part of you, the individual, is going to be the lifestyle modifications. If you are smoking, that has to be at the top of your list of things to really, really strongly encourage you to stop. When you smoke, you dump into your body more inflammation. Specifically, you raise the level of that little soldier, TNF-alpha, that some of those biologic medications are hoping to lower and get, lessen to help your disease get better. You're just dumping more of that in. And so those medications really can't work optimally. And they're expensive. Smoking's expensive. Your disease will not get better so long as you are smoking. So you have to begin to contemplate the journey of quitting tobacco. And it is a long journey. The other lifestyle aspect is weight management. Having an exercise routine, seeing a nutritionist, addressing dietary factors, that is really important. Weight loss, weight management is a sensitive topic. If you struggle with your weight, chances are you have been told by healthcare providers, maybe not in the most gentle manner, that you need to lose weight, and it gets annoying after a while. But in this disease, the disease process itself makes it harder for you to lose weight. It makes you more likely to gain weight and to hold on to weight, and the weight that you hold on to further drives the disease. And imperative to the management of this disease is having a behavioral health advocate on your team. Maybe not somebody that you see all the time, but somebody that is there, that you are tapped into, that you can access if and when you need to. There's still, even now in 2019, this attitude about mental health that it is somehow a lifestyle choice. And it's not. It is a disease. Psychiatric illnesses are true diseases with true underlying pathophysiology that needs to be addressed and has profound impact not only on your day-to-day function, but your life. It is life-threatening to have uncontrolled depression. It is life-threatening. Suicide, life-threatening. So, knowing that as someone with hidradenitis suppurativa, you are at risk for depression, anxiety, mood disorders, please make sure that you are at least aware, tapped into the mental health services in your area. Or you can't do this alone to get better. And please do not struggle alone with this. I hope this video was helpful to you guys. If you liked it, give it a thumbs up, share it with your friends, and as always, don't forget, sunscreen and subscribe. I'll talk to you guys tomorrow.